be the one to come out of the denial prior to the addict, because if we wait for the addict to hit their bottom, we know where that ends up. It ends up in jail, psych wards, dead, worst case scenario, dead. And while they're still breathing, I believe we have a chance in saving them from the addiction.
Now, Ken, you've been doing interventions for how long?
I've been doing interventions. I've been working in the field almost my complete sobriety, and I have almost 19 years clean.
Congratulations.
Thank you. And I've been doing interventions since about 2000, the past 8 years, working with family members, getting educated on the different types of interventions that are out there. There's different, systems of way of doing interventions. And I still work within my company more on the Johnson/Storty model versus the family systemic or the Arise model.
Okay. How do you know if someone's an addict? I mean, explain to me the difference between someone that maybe abuses a substance and where that crosses into an addiction. Say somebody's watching today, and what signs can they look for, and what questions can they ask themselves about their loved one to maybe get that person help?
I think there really isn't any one question to ask on that, because we're dealing with, addiction hits all walks of life. It's not prejudice. So you really can't, ask that question. What if you're dealing with a 12-year-old or 13-year-old? Are they changing? Are their grades dropping? Are they changing their friends? Are they, something like that? I've also conducted an intervention here in New York on an 80-year-old female. Her husband passed away, and she was starting to, deteriorate in her alcohol abuse because her will was to die, and her kids didn't want her to die. So there would be different signs to look for. So I think whenever there's behaviors that are damaging, that you feel that, and as minimal as they could as possible be, take action on it. At least contact a professional and say, here are some of the behaviors I'm seeing demonstrated in my loved one. And everybody knows somebody that's an addict. So that's the reality. So if you know of that person that you could think of that's an addict, and look at their behaviors, and then contact a professional, contact an interventionist that could tell you, are these signs that I should be concerned about? And then I think it would be better off to address their questions versus just widespread on looking for signs, because it could be very minimal. I mean, it could be a binge drinker, that's been binge drinking for like 20 years. And that person may need to get into treatment because it's getting worse as they get older.
So it's not a checklist. It's really important to speak to a professional. Mm-hmm. It's not something that you can check A, check B, true, false. I want to backtrack a little bit. You said it crosses all boundaries. Mm-hmm. Can you share with the people the difference, the different professions that you've dealt with? I know there's a huge stigma attached, which I hope Inside Addiction will be able to break through some of those walls. The drug addict isn't the junkie. Mm-hmm. The alcoholic isn't the person drinking out of a paper bag in an alley anymore. Share with us some of the professions that you've worked with.
I've worked with all walks of life. I've worked with people that are homeless on the streets, shooting up heroin at 23 years old, and I've worked with physicians. I've worked with multimillionaires that created their own company from the ground up. I've worked with pilots. I've worked with all walks of life. Like I said, it's not prejudice. It crosses all walks of life, this disease. And the hardest ones to really deal with are the ones that think they know it all, that aren't willing to learn, that haven't hit that bottom yet where they want to learn. So just like you would talk to any psychiatrist or any therapist, sure, the best patient that they have is one that's in enough pain that's teachable. If you go into therapy and you think you know it all, you're not going to learn anything. But if you're vulnerable enough, then you will learn what's necessary to get through you. through to you. Like when people come into treatment, you know, the ones that are the most vulnerable, the ones that experience the most pain, they're the ones that jump in and they do what needs to be done and blossom in their recovery. The ones that are there because, you know, they're sitting there and thinking, you know, oh, I'm just doing this because, you know, I have to do it because the law told me or my family told me.
I don't want to go to prison.
I don't want to go to prison, which we see on the television all the time. We see a lot of different people out there, you know, that are going to treatment versus going to jail, and they're just doing their time.
Going through the motions.
Going through the motions. But the ones that have felt some type of pain or consequence that says, I need to change or I will die. When they get educated, and I don't believe that even those that go to prison or go to treatment versus prison and they're there, you know, doing their time, I believe that they still get something out of this. They're still getting the education. They'll, you know, like they say in the program, you know, once you go through it, you know, it ruins your high, right?
It's not fun anymore.
It's not fun anymore. So I believe treatment is good for everyone, and I know a lot of people that have gone through 10, 20, 30 different treatment facilities, and it takes that long. And I've known people like myself that it's only taken once. So,
now, Ken, going back, you mentioned people's bottoms, and they have to hit a certain point. You brought up something interesting. You made a reference to a 21 or a 23-year-old homeless kid on the street shooting heroin.
Yep.
How much more of a bottom can somebody that's homeless reach? How do you reach someone that's homeless and basically says, I'm homeless?
Yep. And
what more can I lose? I don't have a job. My family doesn't care about me.
Yep.
I'm picking food out of a garbage can. I'm panhandling money to get a $20, you know.
Did you know him? Sounds like you're explaining the story of the person I worked with.
How do you reach someone that, in my eyes, you know,
Yep.
what else can they, what else is there left besides death? How do you reach a person that, you know, I know everybody has a different bottom, but how much lower can you go that?
Well, like I said, every single person that's breathing has a bottom. I'm working with a family member right now, and the problem being is that the addict's only wish is to die. They don't want to live. Their goal is to die, but they're too afraid to commit suicide. So how do you give them that spark of hope? How do you get them that help that they need? With an addict that's homeless on the streets, this individual that I was working with was going to a freeway off-ramp, and he was collecting money panhandling. He was getting between $75 to $150 a day, getting his heroin and getting his alcohol to feed his habit, get up at 4 or 5 in the morning, and then go to sleep at 6 or 7 when the sun went down, and then right back, same system, just keep moving, moving, moving.
Sure.
And he's already cut off his grandparents that brought him up. He's already cut off his brother. His brother wanted nothing left to do with him because he tried everything. And he said, we went through the same upbringing. You know, we had the same life prior. And how come you're the addict? So the brother got angry, you know, doesn't understand the disease, doesn't understand the disease concept. So with the brother, he was really angry and left. The grandparents left. And the only one left was the sister. The only one left to help this kid was the sister. So she stepped up to the plate and she said, I need to do something to help my brother. I don't want him to die. So she contacted us as professionals and asked us to help her. And as I said, every single human being, no matter how low they are, they have a bottom. They have a bottom. And for this individual, what we did is we first tried it with the love of the letters. Like I said, 80% of the people will go to treatment when they see that people love them and they don't want them to die. So we